you for joining the Chamber and the town as we host our COVID-19 health procedures presentation. I'm going to introduce you to Dave Reese, and then Dave will present, and then we'll have an opportunity for some questions. Currently, Dave is responsible for management operations at Barrow Safety Services. He oversees day-to-day operations. He has extensive training and experience both in health and safety. He's qualified in both municipal NFPA 100 levels and industrial NFPA 1800 and is firefighting and fully qualified instructor. He has extensive knowledge in respiratory protection and use of PPE. He also specializes in instructing rescue for working heights and in confined spaces. And for safe use of industrial mobile equipment. Dave, thank you very much for joining us today. I will turn over the presentation to you.
Well, sounds like the audio's back.
Can you go ahead, Dave?
No, it was almost like somebody, it was a muffled kind of a sound there for a bit, and now I'm hearing it. Yeah, are you not seeing my video?
I am not. And I show you as both mic and video live. Josh, are you with us?
Yeah, I'm on the line here.
Okay, Dave is having trouble getting the presentation going. I'm not sure. I show him as having both his mic and his video, but I'm not seeing anything on my end.
Okay, it is going through on the stream for the video and for the audio. I can see it on the monitor and in the Zoom session that I'm in. It is possible that because of the double user thing that we're doing right now for me to assist you, that it's being weird for your screen in particular, Scott. Dave, are you able to speak a little bit so we can test that again? Hello? See, I think he's not receiving audio somehow. Dave, is it possible you've got some of your devices muted there somewhere? I guess if he can't hear us, I don't know how he get that message.
I'm going to text him or chat him.
Okay. Thanks for the patience to our viewers on YouTube. Not sure exactly what tech issues we're having here, but we'll bear with us and we'll get through it.
Thank you.
This is Dave.
Dave, it's Scott. I can hear you.
Yeah, the mic is definitely live because we heard that through the feed. But it sounds like you've got a secondary speaker or something.
Can you start your presentation, Dave?
Yeah, I'll just share my screen and we should be able to start doing it from there. I can hear you again now.
That's because I'm on the phone, right? So
no, actually through my other earbud.
Oh, okay, all right. I'll hang up then and we'll get it started. Okay, thanks.
Okay.
Thank you again, everyone, for your patience. We're going to give this a try. Go ahead, Dave. Thank you.
Okay, I will start sharing my screen here and we should have success hopefully. Can everybody see the respiratory program slide? Perfect.
Yes, we can.
Okay, excellent. So, quick introduction, even though you can't see me anymore. My name's Dave Reese. I work with Barrow Safety Services here in Hinton. I'm also on the municipal fire department here in Hinton. I've been a municipal and industrial firefighter for just over 20 years and a safety professional for just under 20 years now. So I have extensive knowledge in respiratory protection. I offered to do this because a lot of people have been phoning and asking questions. I thought this would be an easy way to get it to a larger group in one shot and allow you guys to be able to ask questions as well. I'll try and keep the presentation as short as possible. For anybody out there who is listening that actually knows me, you know I like the sound of my own voice, so that could be tough. But we will see what we can do about keeping this as short as possible so you guys can ask questions at the end. Except my presentation isn't advancing. There we go. Okay, so we're going to go a little bit over the regulations, not heavily into the regulations, just so we understand what we are dealing with when it comes to respiratory protection. We're going to define a lot of the respiratory protection that you guys are going to now be exposed to, that you may or may not have been exposed to in your working history, depending on what areas you are working in. Identify the types of hazards, especially specifically what we're dealing with in regards to the COVID-19 pandemic. The type of respirators that are out there, the selection of what you should be wearing, and how to fit test effectively. So some of the things we need to look at when we are talking about these things is all of our respiratory protection is geared towards preventing harm to our respiratory tract over a time-weighted average, usually an 8-hour limit. And this is what it is set up by OH&S. In regards to what we're dealing with now with the COVID-19 pandemic, it's a little different. We're more focused on moving a specific virus that is transmitted through droplets of saliva from your respiratory system so that you don't get infected. But to understand where respiratory protection came from, it helps to understand what the rules were and how it was established in the first place. So types that we're going to see are air purifying respirators, escape respirators, and how do our fit tests. We need to make sure that we are dealing with the right type of respiratory protection. In this case, we are dealing with HEPA filter style, and we're going to work out our hazard ratios based on what type of exposure we think we're going to be exposed to. So first thing we need to look at is identifying hazards. Unfortunately, with the situation that most of you are finding yourself in right now, the identification of the hazard as far as concentration that's in your environment is very hard to do. That's why the new recommendation that's out is that everybody wears a mask. Is basically a similar recommendation that we use in industry a lot, and that is, if we cannot effectively identify the hazard level, then we have to assume the worst. So by putting everybody who enters your establishments into some sort of barrier mask, you're reducing the risk of anything being exposed in your work environments. And by wearing one yourself, you're both preventing you from exposing anybody else. And as long as the maintenance and care of that mask is done effectively, it can be a tool in stopping you from being infected. The issue is when you do not care for those masks, when you do not put them on or remove them effectively, you could actually be exposing yourself to the hazard in that process. So what determines the type of hazard? Usually we will go by nature of contamination. In this case, it is a what we call a mist, and you'll see that term used later on along with a number of others. So it is a product that is carried in a droplet of moisture, some sort of liquid. In this case, most probably either from the exhalation of your breath or from somebody sneezing or coughing in your environment. When we're talking about dust, vapors, and fumes, those are the types of respiratory hazards that are effectively protected by HEPA filter style masks. So that's where the procedural masks, the N95s, or the half mask respirators with a P100 cartridge are effective for controlling this hazard that we are dealing with currently. Other types of respirators, of course, are for gas or oxygen-deficient atmospheres. We're not dealing with any of that in this case, but that small droplet that you are trying to minimize your exposure to can be effectively controlled by a 0.3 micron or above HEPA filter, which means that any particle 0.3 microns or larger is filtered out by that mask. Basically, when we're looking at our formats, we need to make sure that we understand our environments. For those of you that have HVAC and air exchange systems in your work environments, this is contributing greatly to keeping the atmosphere clear in your environment for both your normal activities and in cases to minimize the amount of time that these droplets are in your direct vicinity when you're working. For those of you who do not have any type of HVAC or air exchange system in your facility, it comes down to effective cleaning and effective control of the hazard by ensuring that wherever it lands, if it within the work environment is effectively disinfected and cleaned on a continuous basis. Mists, as I said, very small liquid droplets, and within that liquid droplet is the virus, right? That's the potential transfer mechanism that we are dealing with today. We are looking at a transfer within that small droplet of in this case, saliva or mucous membrane that is basically being transmitted to you through that. And that's what we are trying to filter out. And again, that's where our HEPA filter masks will stop it, but it does then live for a period of time on the outer exterior of the mask. So cleaning the masks, effectively removing the mask is essential to ensuring that the contamination is not transferred, even though you may have not inhaled it or allowed it to enter your respiratory system through direct exposure. Secondary exposure by taking the mask off and then putting your hand to your face is a serious consideration that you need to make sure that you are guarding against. So what kind of masks are out there? Half mask, full face, air purifying, and escape. So our half mask respirators generally are a reusable rubber or silicone based mask that will have various types of disposable cartridges that can work with them. Okay, our disposable masks are just that, our N95s or procedural masks that are designed originally for single use. Now, we are looking at trying to extend the lifespan of these masks due to market conditions and shortages that are out there right now. But ultimately, these masks were designed for single use. So they have a very limited lifespan, even when we are trying to extend the life beyond that single use it once, throw it away, and make it last maybe for the full day or duration of time that you're open during the day. Okay. Single-use disposable, no replacement parts on these, and but to be effective, must have two straps. When we get into the question and answer period later, I've got a variety of masks here with me that I'd like to show you guys, because a lot of what we're seeing now aren't adequate masks for what we're trying to do. The N95 mask, which is a disposable single-use mask that meets the NIOSH standards, does have two adjustable straps. What we're seeing with the KN95s, which are the replacement mask that we are now importing from China, is a lot of them will have the ear loops, which means you have very little mechanism to be able to adjust the fit of the mask. There is ear savers out there that can help with that, but whether you have access to them and using them effectively, we'll talk about a little bit at the end of the presentation. So our electrostatic half mask, silicone or thermoplastic or rubber, these are reusable masks and they are fully submersible to be cleaned. So again, I've got an example of those that I will show you at the end, but they are a more robust mask They allow you to be able to reuse the mask effectively because that's what they're designed for. They also work better in regards to being fitted because you're fitted for the exact mask that you're going to take away. N95s, sometimes you'll be fitted for, say, a 3M style, and then the next batch you get is Honeywell or another manufacturer. Whereas if you're always putting the same mask on your face, there's less chance of that fit ever being compromised. The cartridges on these masks are disposable and reusable to the point of saturation. So within the time frame of the pandemic, I've sat on a few panels and boards that we've looked at the duration of the P100 filters for the reusable masks. And it's pretty much a unanimous thought process across industry right now with the people who understand respiratory protection, that one set of these P100 filters is going to get the average person all the way through this pandemic. If you are an emergency room or a doctor or physician that is going to be intubating, then yes, probably you will need to change out these cartridges at some point. But if you're just on average working your normal day in your normal environment with standard air being exchanged, hopefully within the building, then you should be able to make it through the entire pandemic with one set of filters, because these filters are designed for heavy saturation environments. And this is not what we're seeing here. It's a light saturation environment and a single potential that you're guarding against. Full face respirators, these give you a higher level of protection. So far, the only people that we've seen actually requiring these are those doctors that are actually intubating patients, because they are very close to the patient at the time they're doing it, and there is a high chance for saliva to be aerosolized during the process, meaning that it can be expelled very close to the respiratory tract of the individual that's doing the intubation. That's why we recommend that they have the full face masks, because it allows them not to have to wear multiple things like face shields and safety glasses and half masks, which become quite cumbersome. The full face mask actually replaces all of this. Filters and cartridges need to be specific to the environment that you're going to be working in. What we're talking about for the environment of the pandemic is the P100. Now, I'm sure all over the news, all over everywhere now, you're hearing N95, KN95, P100s, things like that. So N95 is a NIOSH standard. NIOSH is a group out of the US that sets standards for respiratory protective levels. So an N95 mask means that it is a HEPA filter mask made from a material that will work from a 0.3 micron particle and above. So it will filter a 0.3 micron particle and above. It is non-oil resistant. That's what the N means. Not that that really applies to our environments here, but just so you're aware of what the full standard is. And it is 95% efficient. That's where it gets its 95 designation. Okay, the P100 cartridge that we have been selling with the half mask respirators for the people who want to go to that reusable level of protection. The P basically means that it is oil resistant, and the 100 means that it is 99.97% efficient from that 0.3 micron particle and above. So it's just a slightly higher level of protection. The N95s are sufficient for the products that we're dealing with within this situation. It's just that they are disposable, and as everybody I'm sure is aware, the market on disposable masks right now is very tenuous at best to even receive them. And if you do, you are paying a huge premium right now on the mask cost that you're paying. So the reusable masks have become more popular with the P100 filters. But so you understand the standard differences and the protection factors within these of what you can do with the masks. Okay, so like I said, and non-oil resistant, P oil proof. So that's the difference in the lettering. 95 is 95% efficient. 100 is 99.97% efficient. If we are storing cartridges, of course, they should be kept in a clean, sealed container. That way they don't become contaminated. The P100 section of the cartridge will not expire. It is a paper style filter. The reason that you will see some expiry dates on certain N95 masks is there are manufacturers out there that actually put an electrostatic charge into the mask. And this is to help with the collection of the particles as you breathe in. As it is filtered through, it gives you a little higher proficiency in the collection of the particles. The difference is, and the reason they put the expiry date on it is because the manufacturer is not sure how long that electrostatic charge actually lasts. So there is a potential that the electrostatic charge could dissipate over time, so you include an expiry date. Health Canada has approved the use of expired masks during the pandemic because the actual filtration body, the HEPA filter that stops the 0.3 micron particle is still intact, right? It's just the added over and above electrostatic charge that may or may not have dissipated during the time after the expiry date of the mask. Of course, any mask you should put on, you should first do a visual check on, because the other things that can degrade with the masks if they are not properly stored is, of course, the rubber straps that you've put around your head. And some masks you'll see will have a rubberized seal around the edge of the mask. And that, if stored ineffectively under fluorescent lights or in an air where sunlight can expose it, can degrade due to UV rays or due to fluorescent lights, as most things can. So make sure if you are picking up a mask, whether it is beyond its expiry date or not, that you're doing a full visual indication or inspection on it, indicating for any damage or deficiency that may be in the mask. So when we are selecting some respiratory protection for our appropriate hazard, we want to look at things like identifying the hazard. Right now, the identified hazard that we're dealing with is the COVID-19 virus, and its method of transmission, of course, is that droplet of moisture that is being expelled by an infected person. So we understand the mechanism, but we don't understand the concentrations. It is almost impossible to be able to say what the potential concentration of exposure is in this regard. The procedural masks, N95 masks, and P100 masks are, by all accounts, overkill for the protection factor that we need. But because we cannot effectively identify the concentration, more in this case is better, right? So a higher level of protection gives you more confidence, more security that you are effectively protected when we can't understand the exact concentration of the product that we are trying to deal with. So concentrations, of course, are key to understanding what we should be looking at. In this case, we're kind of going over and above with the protection factors to ensure that we are protected from that concentration. IDLH, we're not going to worry about. That's immediately dangerous to life and health, and nothing that we're dealing with in this particular situation falls into that category. So other things you may want to look at when regards to the contamination is, are you effectively protecting other areas where it can't enter your body? So the next, outside of the nose and mouth, which is protected by the mask, the next greatest hazard area is your eyes. So if you are in a high concentration area or in a close proximity to somebody for a prolonged period of time, you do want to have some sort of physical barrier that is going to stop that from being able to, that contaminant potentially from being able to enter through your eyes. So that's where you're seeing a lot of people wearing face shields, safety glasses, or in a lot of cases now, the plexiglass barriers that you're seeing between you and the people that you're dealing with in regards to close proximity activities like being at the till at the checkout or within the vicinity of somebody within a work environment. Our protection factors are something we're going to touch on really briefly just because of our fit testing capabilities. So half masks and pulses will have the same protection factor with a qualitative fit test, and you get an additional protection factor with a quantitative fit test. I'll touch on the difference between the two styles of fit test here in a few slides so that we can understand if you are being fitted for a mask, what the difference is, which is more effective, and how they work. So, considering the contaminations, looking for the warning properties we've already looked at, selecting our filters and cartridges, we're going to do our N95 or P100. Special considerations when we're wearing this type of equipment. So this is something that you guys have been probably exposed to by now if you are wearing the masks. Every time you put the mask on, you should be doing a negative and positive pressure checks to see if you actually do have any type of a seal. Easiest way to do that, if you have an exhalation valve in the mask, is to block the exhalation valve and see if the mask actually holds pressure. When you draw in, you should be able to feel the mask collapse a little into your face. If you're using the half mask respirators, you do this by removing the cartridges, putting the heels of your hands over each of the openings, and the mask itself should collapse into your face. With the N95s, if you do not have a exhalation valve with the N95, then the negative and positive pressure checks aren't really effective. If you do have the exhalation valve, then the positive pressure check is the one that you can do, and that is breathe lightly into the mask with the exhalation valve blocked and make sure that it holds pressure within the mask as opposed to just allowing the air to escape through the seal. So this is a negative pressure with a half mask, positive pressure with a half mask. Again, blocking that exhalation valve with the N95s does also work for the positive pressure. Fit testing. So a lot of you are out there and wondering about fit testing. Fit testing, there are two styles of fit test. There is qualitative and quantitative. Qualitative fit testing is where you use a Bitrix or irritant smoke style solution to try and see if there is an effective seal to the mask. So if anybody's ever had the white hood put on and with the big clear window cut out with the hole in it, and somebody squirts a product in there that is meant to irritate your respiratory tract but not cause you harm, if there is not an effective seal in the mask, that is a qualitative fit test. Or if you've been wearing a mask and somebody with a small smoke ampule comes around, waves it around the edges of the mask along the seal. Again, it is an inert smoke that will not harm respiratory tract, but will cause a little bit of irritation and get you to cough if the seal is not effective. That's what we call qualitative fit testing. Quantitative fit testing, they actually hook you up to a machine and basically it measures the amount of particles that are allowed to transfer through the mask. And it has to be within the fit factor or the manufacturer's specified range of particle transfer within the mask to be able to be considered a successful fit. It's a much more scientific way of fit testing. It gives you a better fit seal and gives you a higher protection factor with the full face masks so that you can go into a higher concentration of product. Both are acceptable under OH&S and Alberta legislation, but we do find that the quantitative is a better system to use. The downside of the quantitative fit testing for the N95s is because you have to actually puncture the mask to hook up a sensor line, it does destroy a single mask. So if you have a box of masks, and again, under normal conditions, destroying one mask during the fitting process is not a big deal. Considering the availability right now, we are trying to shy away from doing that just because it does end up costing you one mask, which at this point in time is a significant investment and one that not always can be replaced. The downside of the qualitative testing with the N95s is whichever product they are using, whether it be the irritant smoke or the Bitrix, does leave residual on the mask. So if you then were to use that mask for an active respiratory protective exercise, there is potential that you're going to get some irritation from the product that was used during the fit test product. So again, under normal circumstances, regardless of style of fit test, for an N95 mask, we usually crumple up the mask that we've used and throw it in the garbage. During these extenuating circumstances, we're trying to minimize that, but there are side effects of that. There are limitations in regards to that, and that being that you do potentially have contamination of the mask, or if it's a quantitative fit test, that you have destroyed one mask to be able to do it. So qualitative irritant smoke or Bitrix. Our exercises stay the same regardless of style of fit test. So normal breathing, deep breathing, turning your head, nodding your head, talking out loud, normal breathing. If you are going to a certified fit test professional to have this done, these are the steps they should be taking with you. If they are not, then chances are the fit that you are getting is not going to be effective during your daily activities, right? You need to be simulating normal activity while you're doing the test exercise to ensure that the fit stays solid while you're wearing the mask during normal activities on a day-to-day basis. Otherwise, there's really not much point in doing a fit test if all you do is stand there stationary, unless your entire job is standing there stationary. So cleaning of these things. When we are working with the N95s, there are some new protocols out around cleaning them, and certain products that you can use that they say will disinfect them. They cannot be submersed in water for the N95s. They can be sprayed with these new sanitation cleaning products and then hung to dry. The concern that is floating around with these is, one, we've got no long-term data to know whether or not you can effectively clean an N95. And also, if you have sensitivities, the products that you are cleaning the N95 mask with may cause irritation when you put the mask back on and wear it for an extended period of time, okay? If you have a half mask respirator, you remove the cartridges and the mask itself can be fully submerged in a cleaning solution, mild soap, a disinfectant that will effectively clean the entire mask, and then it should also be hung to dry. If you're using P100 cartridges and they are of the hard case style or hard plastic outer shell, they can be wiped down with a disinfectant cloth or something that will effectively remove contaminations. If you're using the soft-sided cartridges, and again, at the end, I will show the difference of both, cleaning them is a little more difficult. They are not designed to be cleaned down or wiped down with any type of water-based cleaning agent. So again, spraying them and hanging them to dry may be effective, but we have no quantifiable data that proves that it is. The difference between doing that with your P100 filter and your N95 mask is the P100 filter itself doesn't touch your skin. It is the silicone-based or rubber mask that touches your skin. So you are limiting the exposure you may have to that irritant or irritations later on, like you would with the N95. Again, rinse, clean, disinfect, hang dry. Make sure it is fully dry before being used again. When you are putting these things on, regardless of style, N95 half mask or full face, you should be doing a visual inspection every time you put the mask on to ensure that the seal is not compromised in any way, that there's no product that's going to cause irritation, that all components of the mask, if it has an exhalation valve, are working effectively, and that you've done that positive or negative pressure seal check once you have put it on. If you find the straps are starting to crack and decay or dry out, chances are you're going to have to replace that mask. If you're finding that the seal is no longer effective for whatever reason, it may have been, it may have just be dried out over time, or if something has been sitting on the mask to cause a divot into seal where it will no longer seal to your face, the masks will have to be replaced. Head straps, again, are something you want to be paying particular attention to, because that is how you tighten the mask to your face to ensure the seal is effective. Cartridges and connections between the cartridge and the mask do have to be a nice tight seal, because air takes the path of least resistance when you're breathing in. If there is any damage to the mask itself, whether it be N95 or reusable, air will seep in through those voids or crevices or cracks within the seal. It's less resistance when you breathe in to come in through that clean path, through the crack or break in the seal, as opposed to through the filtration that you are looking for to ensure that you're not breathing the contamination. So that's why these seals are so important, right? Because otherwise you're just breathing in through the break in the seal, as opposed to filtering the air that you are bringing into your respiratory system through the effective filters of the cartridge or mask. Storage of these, something we found really effective for the N95s, if you are going to be reusing them, is the small Ziploc hard side containers that are on the market, kind of like the disposable or limited life Tupperware kind of stuff. If you want to reuse a mask, find one of those that allows the mask to fully sit in it. And once it's cleaned and dried, put it back in there. It gives the mask a level of protection because of the hard sides and lid on the case, so that you're not opening it up to the potential of something falling on it or being put on it, crushing the mask, and by that way disturbing or degrading the seal because something has been put down on it. It's something that because we never use them or reuse them, never really thought of before, but it's an idea that was floated around in some of the online blogs that I participate in for respiratory protection, and it seems to have been very effective in preventing damage, especially to the N95s, if you're going to be reusing them more, over time. Things that can cause people wearing a respirator to have issues. So if you are wearing a half mask, a reusable half mask, or a full face respirator, and this is new to you, it may create a fairly claustrophobic environment. We have had people come in to do fit testing and they just don't feel comfortable wearing the mask. Mostly the full face, because you can see the edges of the mask in your field of vision, which means that you're feeling quite closed in when you're wearing it, okay? The half masks, to a lesser extent, this is usually caused by the additional effort it takes to breathe through the filters. So if you already have a compromised respiratory system, if you have trouble breathing in and out, conditions like COPD or asthma or any type of bronchial issue can be more emphasized by this, because you are breathing through a filter. There is resistance there. Okay. We find people with high blood pressure or heart disease, again, because there's more effort put into the breathing, more exertion into your breaths, can cause issues with this. Similar with diabetes or any type of seizure. And then if you have a sensitivity to wearing these masks, I'm sure you've all seen the Dove commercials, I think it is, that are out. The healthcare workers that have been wearing the prolonged use of the masks, where they're seeing irritation and redness and soreness and rub points with the masks. So this is definitely something you want to take into consideration in your mask selection, and making sure that you are choosing the correct mask for your level of protection. You don't want to be going too far over the top, but you do want to have sufficient protection for the environment that you're actually going to be working in. Once you've made an assessment to decide whether or not a mask is right for you and what type of mask is right for you, make sure that you understand the limitations and potentials of the mask that you're going to be wearing in the environment you're going to be wearing it in, so you fully understand whether or not you are adequately and effectively protected from the products you're going to be dealing with. Okay. Duration of use, again, we have kind of changed the numbers on that just due to our availability of masks. The half mask respirators with the P100 cartridges are designed as a reusable mask. They are a good solution for people who are going to be utilizing these masks on a day-in, day-out basis for a long period of time. The N95s are a smaller footprint, smaller profile mask, but are designed in their essence as a disposable mask. And anytime that we are extending the life of any disposable product, then we are not effectively seeing the full use of it. That's the presentation. Hopefully everybody could hear it. Beyond that, I want to open it up to questions that you guys may have. I think probably the best format might be to do by text so that we are not overwhelming the audio system.
Dave, at this point in time, I have a couple of immediate questions for you while we wait for the others to come in. Can you hear me? Excellent.
Yep.
Can you speak to the current supply in Alberta?
For N95s or for half mask respirators or for everything?
For everything.
So for everything right now, N95s are very hard to come by. We are seeing a equivalency product is what they're calling it. So an N95, this is a style of N95 that you can see has the exhalation valve. This is an N95 as it is stamped here, but does not have an exhalation valve. What we're seeing enter the market are these, which are KN95s, which basically are a Chinese equivalent of what we're seeing out there. These are fairly readily available on the marketplace, but we have found them to be the same quality or standard as the N95s. As you can see with the N95s, a little closer to the fully adjustable straps. These just have the ear loops, which really limit your ability to be able to put this on your face and get an effective seal. The ear savers, or the little bands that people have been selling and making now that allow the straps to be pulled tighter, do work, but they're not 100% effective in creating that seal. So right now, our supply and availability of N95 and KN95 is very limited. It is also at about, I would say, 1,000% premium. I used to be able to buy a box of N95s, 20 of them, for about $22. Last pricing I saw was $140 for that same box of masks. So we are seeing a huge demand, a very limited supply. And so what we're seeing is a real shortage of these types of masks on the market. If we're looking at the half mask respirators or full face respirators, basically because these have not been made as popular in the news and in the media, there is still limited availability of these types of masks out in the environment. I also have another style of mask that I have been able to procure some of coming out of the city. They are a reusable N95 style mask. So they look like an N95, they fit similar to an N95, but the filter inside them is reusable and replaceable. So it's a hard plastic shell that looks like an N95 that we can then replace just the filter part on. The availability on the reusable respirator systems is still limited, but is much more available, and the pricing really hasn't upped at all in regards to buying one of these as opposed to buying the N95s. So our N95s right now, for about 4 of these, you can buy 1 of these, and it's usually you can buy 4 boxes of these for 1 of these. So if you are out there and actively looking for the types of products, then you are in a very limited market. The other thing that we are finding is the reusable non-surgical masks, okay? So reusable non-surgical masks are available in the marketplace right now. And for a lot of people, this is adequate protection for what they're going to be needing. So if you want to leave the N95 market alone, since it is in such high demand right now, if you feel you need a high level of protection, you're probably better off going with the half mask respirator. If you feel that you just need a regular level or public style level of protection, then the reusable masks are the way to go. They are washable and can be reused on a regular basis and work very well in regards to blocking your exhalations and anything that's coming from you, and also filtering what is being put into the atmosphere. Again, as long as you're using effective mechanism for the removal of the mask and proper cleaning once you have taken it off.
So further questions then, Dave. Could you then tell us if there's going to be any relief, or if there's production that's been ramped up so it looks like we're going to either see more stock or lower prices? And then briefly talk about availability of face shields, please.
Okay. So realistically, we're not going to see any relief. They are ramping up production on various locations, but they're nowhere near meeting the demand that's already out there. So this is going to be a longer term issue. I foresee this being at least until the end of 2021, if not when we do see an actual vaccine that is widely disseminated, which is a long time away. People are going to be looking for these products right up until that point. And currently we are not even anywhere close to anything like that. So especially for the decent N95 style products, you are going to see increased demand and a lot of higher cost for the foreseeable future. In regards to the face shields are fairly available right now. They don't have to be any type of an impact resistant material. So there's a lot of people out there just manufacturing face shields and getting them into the market with ready supply as we speak now. So in regards to face shields, we are seeing a lot more supply in the marketplace, and the pricing does seem to be consistent with where it was pre-pandemic, as opposed to things like the masks.
All right, so I've got one last question for you, and it may appear that you've already answered it, but I just want to reiterate from your stance the importance of on-site or off-site consultation to ensure that the equipment that you're using is, number one, qualified, and number two, fits properly as a business owner who's trying to not only protect their clients, but is also trying to protect their staff.
Scott, I can't hear you.
Okay, so I'm going to try one more time, and then I'll type it if you can't hear me. The question was about the importance of consultation, off-site or on-site, to protect both the customer and also the employees.
Scott, I can't hear
Okay,
you.
I'll type it in. Okay, yeah.
So there have been some companies that have actually prepared COVID-19 audits. If you are interested in something like that, those companies are available. You can come in and talk to us here. So if you feel that you are not properly prepared, or you don't have the right level of protection for your staff and your clients, we can come in and do an audit on your facility. Most of the information that you're going to be looking for is freely available, though, through Health Canada, through the WHO, and through ALBERTA Health Services. You can find almost everything you're going to need to be able to be effectively protecting your facility. It may take a little bit of working with all three different groups to find the proper balance, depending on what you're looking for with your specific needs. But all that information is readily and freely available. Mostly right now, it comes down to hand washing, effective cleaning, and basically wearing masks when you're less than 6 feet away from anybody. All this information too is on the town website. Please go to the town website and check that out as well. They've done a lot of links to information that is being shared in regards to effectively controlling the environments that you guys are going to be in.
I'll try one more time to see if you can hear me,
Perfect.
Dave. You can hear me now? Okay, excellent. Thank you very much. I appreciate your presentation today, and I appreciate the patience of all of our listeners and viewers this afternoon as we've had some technical difficulties. Once again, Dave Reese is the Vice President of Operations at Barrow Safety Services, and so he manages the and oversees the operations on a day-to-day basis, and is highly qualified with his safety with regards to confined spaces and also training and firefighting. So basically, this is going to be a YouTube, so that if you watched it and you missed anything, you're welcome to go back. The link has been included with the registration, correct? And if you'd like, as viewers, to share this information with others in the community, we'd certainly appreciate it. Dave, thank you again for your time. We appreciate that. And hopefully this information has been valued to everybody. And perhaps in the future, Dave, maybe if it's okay, I can just leave them your phone number for them to contact you directly. Is that fine? Dave? No. Okay. Sorry, folks. I'm just I'm going to ask Dave here to put in his phone number, okay, or let people know that they can contact him. Okay.
Yes. Yeah. The number is on the banner behind you. For anybody who doesn't know our number, it's 780-865-7763. Feel free to give me a call. I've spoken with a lot of the people in town in regards to explaining some of the requirements and recommendations that they've heard through other places. We're here to help you guys. We've all got to try and get through this together, making sure that we come out of this all, as safely as possible is very important. So yeah, feel free to stop by. If you do stop by, we may ask you to wear a mask. We'll see if we can, we've got enough room to socially distance. But feel free to call as well, or if you're looking for any type of audit or advice around your infrastructure and offices and things like that, let me know and we can get things set up. Like I said, all that information is freely available on the town website with links to all the pertinent sites.
Well, thank you again, Dave.